Hypertension is also known as high blood pressure. And among my patients, about 4 out of 10 come to my office having high blood pressure issues. Most of them are on 2 to 3 medications instead of a single medication, and many have been on those medications for a long period of time. Hypertension by itself, your blood pressure being elevated, is not the issue. It's the consequences of that elevated blood pressure that leads to the problems. The problems that hypertension lead to occur over the long term. It's day-to-day exposure of your system to that elevated blood pressure. The harder work of your heart to be able to produce that blood pressure, the pounding on your circulation, which eventually can lead to strokes, and the pounding on your kidneys, which eventually can lead to kidney failure. Under all circumstances, they're bad things. The difficulty with hypertension is that most of the time when it begins, it starts in people who are young. And they won't see the effects of those blood pressure issues for many years to come. But when they do come, they come with very difficult circumstances and difficult to control diseases. When you add obesity to the situation, your hypertension escalates. And instead of being able to be controlled with a single agent, most of the time you need a second or a third agent. 4 out of 10 people who walk into my office seeking bariatric surgery are already on those medications. When those people have surgery, whether it be band surgery, bypass, or sleeve surgery, there's a profound effect on their blood pressure needs when their weight goes down. As their weight reaches a threshold of about 30% of their weight loss, their need for their blood pressure medications in most circumstances goes down, sometimes to no more need for blood pressure medication. I often see about a month after surgery that the weight loss is already significant enough to make somebody's prior to surgery blood pressure medications be overdosed, and those medications need to be decreased. Most people will get off at least one of their medications in the first month, and then over the course of the next second or third month, get off the other medications or get significantly reduced in the amount of medication that they take. That's a very good thing for a variety of different reasons, not the least of which is the cost of the medication, but also the side effect of blood pressure medications. Blood pressure medications affect many different things in people's quality of life, not the least of which is their sex life. And very often, people can't engage in intercourse anymore because of the effect of those medications. It's a very interesting circumstance, but I see patients 3 months after my surgery very often with a big smile on their face because they've been able to do things at home in the bedroom that they have not been able to do for years, and they thought they'd never be able to do it again. So it isn't simply a measure of what's the effect on your blood pressure, it's a measure of changes in your quality of life.